Okay everyone, so good afternoon and welcome to Trinity College Dublin. My name is Deborah Hendy and I'm a clinical speech and language therapist. So I graduated in 2011 and today I'm going to be talking to you about undertaking a speech therapy degree here in Trinity. So what it involves, the entry requirements, and then also your job opportunities at the end. So a degree in clinical speech and language therapy, it's a 4-year degree course in which you get an in-depth understanding of communication and swallowing disorders, and it teaches you how to work as a speech and language therapist, helping people who may experience these difficulties. At the end, you will be awarded a BSc in clinical speech and language therapy, and the course is accredited by the Irish Association of Speech and Language Therapists. There is also a mutual recognition agreement between Ireland, the UK, the US and New Zealand, and this does help to increase job opportunities. So we're going to start by talking about communication, which is a lot more than just words. So communication comprises all these different elements. So language, that's listening, speaking, reading, writing, both the understanding of this and also the using. Articulation and phonology, that's speech sound production. Your non-verbal communication, your fluency, and also your voice. So communication. It is the ability to communicate is central to everything that we do, to who we are, how we learn, how we relate to each other in all these different realms. So communication difficulties can impact on people's ability to participate in educational, social, economic and career opportunities. So it's a vital aspect of everything that we do on a day-to-day basis. So SLTs specialise in the assessment, diagnosis and treatment of communication disorders. So what is a communication disorder? It's difficulty with the understanding or use of speech or language to relate to others in society. We also deal with dysphagia as a speech therapist. So this is an eating, drinking or swallowing disorder, and it's also a very large aspect of what we do on a day-to-day basis. It can occur among all age groups, so you may find yourself working with premature babies who have swallowing disorders right all the way up to people in their old age who've suffered a stroke, Parkinson's, the degenerative diseases like that. So it is common in older individuals, such as those who have had a stroke, and it can lead to further complications if not managed. So speech and language therapists and members of the MDT are involved in helping people with dysphagia. So what does a speech and language therapist do? Well, we work with children and adults who have difficulties with language, communication and/or swallowing. We assess, diagnose and enable people to achieve their maximum potential to communicate and eat and drink without difficulty. And we work with both families and carers. So for example, we enable people who have experienced brain trauma, example as a result of a stroke, to regain their functional communication, language, speech and swallowing ability. We facilitate the development of speech and language skills of children or adolescents who may be experiencing difficulties. You can help individuals use assistive systems of communication, like you can see here, your AAC systems. There's a counselling aspect involved that will help families better cope with a member's communication disorder. We also enable those who do not have speech to communicate through non-verbal means. So who does a speech and language therapist work with? Because communication problems can occur throughout any stage of life, you'll find that you work with all kinds of age ranges. So you may work with children with speech, language, voice, fluency or communication impairments associated with things like cleft palate, cerebral palsy. There are intellectual impairments such as Down syndrome, oral or written language disorders like those clients presenting with a language disability or dyslexia, autism and Asperger's syndrome, emotional or behavioural disorders, hearing impairments, many other conditions. We also work with those clients who have mental health difficulties, schizophrenia, things like that as well. Then there's also the adult side, where you may work with adults with speech, language, voice, fluency or communication impairments associated with neurological disorders like Parkinson's disease, stroke, dementia, cancer of the mouth and throat, intellectual disability, mental health problems, traumatic brain injury and also many other conditions. So throughout the Therapeutic Alliance, you'll find you work with the client, be it a child, adolescent or adult. You also work closely with the family, the partner or the spouse, and then the MDT is also an intrinsic part. So you'll work very closely with your doctor, your nurse, your physio, your occupational therapist, social worker, psychiatrist, psychologist, audiologist, dietitian, ear, nose and throat team, and any other specialists who may be involved in the care of your clients. And with children especially, you'll be working with your teachers, your principals, your special needs assistants, and also your care workers. So we work in a huge variety and range of settings, such as hospitals, therapeutic and rehabilitation centres, schools, language units, community health centres, disability services, nursing homes, mental health services, private practice, which is becoming increasingly to the fore, and also you'll find yourself often doing home visits to the client's home. There is an awful lot of variety in the job. It's a multitude of jobs in one, depending on which area you go into. So you may find yourself working with adults post-stroke in an acute hospital. You may then work with children with speech and language problems in a health centre. Adults, children with mental health problems like emotional behavioural disturbances, schizophrenia, adults with intellectual impairment, a person with Parkinson's disease or another degenerative disease. It really does vary from day to day and week to week. So continued professional development. So there is a lot of research and development in the profession, and it's constantly bringing new techniques and new ideas in working with clients in order to provide the best quality service. So there are a variety of postgraduate courses available. I'm currently doing a research master's here at Trinity College. You can also do a PhD. You can look at linguistics, dysphagia, health services management. There really is a large spectrum of different things you can go into afterwards. So the opportunities for employment, there is a continuing shortage of SLT posts at the moment with cutbacks and everything. However, there is a great demand for the service, as there always has been. Waiting lists are very, very high. There are increasing opportunities to specialise and work in a private capacity. That is really growing at the moment, as the public sector, the jobs just aren't being filled there. Working overseas is always an option. The UK, there's a strong connection between Ireland and the UK. You can go as far afield as Singapore, Dubai, places like that as well. There are opportunities as well for further research and education, and it is promoted that you would try and work further and also study. So if you do undertake your degree here, there are certain entry requirements. So in your leaving cert, you need an ordinary D3 or a higher D3 in maths. Then you need a higher C3 in either English, French, German, Irish, Italian, Russian, or Spanish, so one of your languages. And then you also need a higher C3 in either maths or one of your science subjects, so your physics, your chemistry, your biology, or your ag science. I think at the moment the points are 535 for the year just gone. You also, if you look at your prospectus, you'll get some more information there. So the theoretical component of your course, it will consist of lectures, tutorials, and seminars, and it also will consist of problem-based learning. So this is a group-based learning which builds teamwork, communication, and group skills. It's active and holistic rather than passive. And when you're given a problem, you must brainstorm as a group, set goals to solve the problem, and collaborate as a group in assessing and evaluating and using your data from a variety of sources to solve the problem. So this process, it really reflects a clinical situation when a client presents with difficulties that you haven't encountered before and that you haven't heard about in lectures. So it really gives you the skills then and the confidence to be able to deal with those real life situations. So it is a very good way of learning as you go through the process. And then the new information is acquired through self-directed learning, and it's presented and shared with the group. It's clinically relevant problems, applications, and resolutions. So it will be things that we will use in real life situations. So then your clinical component. This allows students to use the theoretical knowledge that they've gained in assessment and therapy with people with communication problems. So the aim is to have placements in a variety of settings, so hospitals, health centres, special schools, child and family centres, and also a variety of client groups, children, adolescents, adults, and also you'll see a wide variety of disorders throughout your placement. So it's a whole spectrum that you'll see throughout your 4 years of placement. So this is a brief overview of your 4 years in college. So year 1 looks at typical development. Then year 2 focuses on the assessment of your speech, language, and swallowing disorders. Year 3, you will focus on intervention. And then year 4, you'll bring everything together and you'll look at the overall management of a caseload and of clients. So junior freshman, this is your first year. Your theoretical components will include general and neuroanatomy. So we look at anatomy from the head just to the kind of the tummy. So then physiology as well for the same area. Anatomy, linguistics. So linguistics consists of your morphology, your syntax, your vocabulary. So what makes up the language that we use. You also look at speech and hearing, speech and language pathology foundation, social and developmental psychology, and also lifespan development. Your clinical component, in your first year it is mainly observation. You'll be visiting centres, meeting with people who have communication difficulties, and you also will go to your audiology clinics. So then your senior freshman year, or your second year, your theoretical components looks at disorders of communication, but the focus is on the nature and assessment of the speech, voice, fluency, language, and communication disorders. You will also look at swallowing disorders, your neuropsychology and lifespan development, your linguistics, your speech sciences. The clinical component then in your second year is a focus on the assessment of people with communication disorders. You'll have clinical placements and clinical workshops, and throughout these you'll assess and really work on your assessment skills throughout the whole age groups. You also look at appropriate frameworks and tools for assessing skills in each of these areas, and as well you'll look at considering the participation needs of the individual with the communication difficulty. So then in your third year, the focus is very much on intervention. So you'll take all the assessment skills that you've learned from your second year and then look at intervention. So your theoretical component will include disorders of communication, the intervention of these, neurology, psychiatry, research methodology, and discourse analysis. Your clinical component will focus on intervention therapy with people with communication disorders. So you're putting all your knowledge into practice now, and you'll actually be intervening in your own caseload. Then you'll also have your clinical placements and workshops as well. So then your final year, your Sophister year, will be a focus on the overall management. So you'll be tying together everything you've learned throughout your 3 years to look at caseload management. Your theoretical components will include disorders of communication and swallowing and the management of these, counselling principles and practice, ethics and administration, and reflective studies, communication and swallowing research projects. So it's in fourth year that you'll complete your research project. And then the clinical component will include clinical placements with a focus on overall caseload management. So at this point, you'll be able to assess and treat your client from beginning to end by the end of the 4 years. So is this course for you? So if you have an interest in science and languages, because that obviously plays a very big role in our job, good listening and communication skills, good social and interpersonal skills, if you enjoy working with and helping people of all ages, and if you're a bit of a problem solver, but as well working independently and as part of a team, because oftentimes you will be problem solving by yourself, but then you will work very closely with other members of the team involved in your client's management. Silence isn't always golden, so sometimes we do need to help. It is a very challenging and satisfying career, but it is very rewarding as well. So these are some useful links then, if you want to have a look. This is the department website in Trinity. Then there are also the Irish, the American, and the British associations. There's also a book which is quite useful. It's called A Career in Speech and Language Therapy, and it's by Kirstner and Wright. So that's a good book as well if you're interested. So if you have any further queries, you can email the secretary at cslssec@tcd.ie, or you can also phone the department, and anyone would be very happy to speak to you. So that is a very quick overview of the 4 years if you decide to take the course. So does anyone have any questions or queries? Yeah.
I'm just wondering, is there much places reserved for mature students?
In the course, every year they take, I think, between 5 and 6 mature students. There's approximately 35 in the class, and 5 or 6 of those places will be for mature students, and the rest then will be through Leaving Cert or A-level entry. Yeah. Is there anyone else? Yeah?
I was just wondering, how much would you say is based around the kind of the language and linguistics elements versus medicine and biology?
Your first year is very much looking at the anatomy, the physiology, because you need your basics to understand how the brain works, for that language to be kind of processed and everything. I suppose it is 50-50. You have to have that understanding to start with, but then the language and all those elements come into it as well. It's about 50-50, but after first year, it's very much a focus on the language side of it, and then looking at the intervention and assessment to treat that. Yeah. Anyone else? Yeah.
How much time do you spend on placement? Would you say it's half and half? Or
It wouldn't be half and half. In your first year, it's very much observation, so they don't throw you in at the deep end. Then from second year onwards, what you do is you do a placement 1 day a week for 8 weeks in whatever particular service you've been sent to, and then you'll do a block placement, which will be about, I think it's 4 weeks in second year, so for 4 full weeks, and then that progresses, so up in fourth year you're doing a 6-week block placement. So they would be your 2 placements. It's not, so there's a weekly one and then a block one. Yeah.
What are the different ways of examining in the course?
It's not continuous assessment. There are practicals, so with your anatomy and your physiology, you'll be doing those with medical students, dentists, physios, you'll all do the same. And you'll have written exams and also practical exams. Then with things like phonetics, that's transcribing speech sounds, there'll be practical exams as well. Then you'll obviously have your Christmas exams and your summer exams, which will be written paper exams. And then as you progress in fourth year, your final exam is an unseen client. And you assess, you come up with an intervention plan on the spot, and then that's what you do. So it does progress, but it's practicals and also written exams. And then towards the end, it will be assessment of you on placement as well. So watching how you treat your clients and everything like that. So it progresses like that. Anyone else? Yeah. Yeah, sure, of course. It's called A Career in Speech and Language Therapy. And it was written by Kersner, so it's Kersner, and Wright, which is Wright. Yeah?
How many hours is it?
In your first year, it is quite full. You'd probably be in 9 till 4 every day. Just because you have to fit in your anatomy, your physiology, everything into those first year or so. But then as you progress, your hours do cut down because your placements will come in and things like that. So in your fourth year, you might have 8 hours of lectures or college work. Then the rest will be the PBL. So those you'll meet as a group outside of lecture hours and do your work then. And then as well, you'll be writing your thesis, you'll be doing your placement work, so that will all come in as well. So it does decrease as the years progress.
Are the anatomy or physiology classes down in James's?
No, we actually have them here. They're in the anatomy building, which is down near the Hamilton Library. So it won't just be a class of speech therapists. You will be doing them, I think, with the med students, and I think the physios did them when we did it as well. Yeah, so no, you don't have to go to James's, which is nice. Anyone else? No? Okay, well, thank you very much for coming.